Hello, my name is Tammy Spencer, and I'm a nurse at the University of Colorado Hospital. This video will discuss how to care for your indwelling urinary catheter. Specifically, I will cover what an indwelling urinary catheter is, how to care for your indwelling urinary catheter, how to empty the urinary collection bag, how to change from a large collection bag to a smaller leg bag, and when to call the doctor. An indwelling urinary catheter is also called a Foley catheter. The catheter is inserted by the doctor or nurse. The catheter is inserted through the urethra and into the bladder, where it helps to drain urine. In this cross-sectional model of the male anatomy, the urethra is represented by the clear tube, the prostate in red, and the bladder in yellow. When inflated with sterile water, the balloon at the tip of the catheter helps to keep the catheter in place inside the bladder. The catheter then connects to the collection bag tubing. When you're discharged from the hospital, your catheter may look like this. Remove the red tape using the perforations in order to disconnect the catheter from the collection bag tube. The catheter securing device comes in two varieties: an adhesive device or a leg strap. The catheter is connected to the collection bag tubing. You may shower with the catheter in place. Do not take tub baths. Use a securing device in order to keep the catheter in place and prevent accidental removal of the catheter. By using a securing device, it also prevents the catheter from pulling, which can cause pain and bladder spasms. It's important to always keep the catheter and the tubing connected. Always keep the collection bag below the level of the bladder. Make sure that the collection bag does not lay on the floor. Empty the drainage bag when needed. You may want to wear gloves. Unclamp the drainage spout at the bottom of the bag. When emptying the bag, make sure the end of the drainage spout does not touch the container the urine is draining into or the floor. Wash your hands after you empty the drainage bag. It's important to follow these steps in order to prevent complications associated with your indwelling urinary catheter, such as infection. Infection is caused by bacteria. Bacteria travels from the catheter to the bladder to the rest of your body. Dirty equipment or handling the catheter, tubing, or collection bag without washing your hands can also contribute to infection. Therefore, it is always important to wash your hands before and after catheter care. This is true for you or anyone who is helping to care for your catheter. I will now demonstrate how to change from a large collection bag to a small leg bag. Assemble your supplies on a clean, dry surface. Attach the leg straps to the leg bag. The top of the leg bag will be clearly marked with an arrow. Disconnect the green catheter cap from the leg bag. Next, connect the extension tubing to the top of the leg bag. Next, disconnect the catheter cap from the catheter plug. Attach the catheter cap to the other end of the extension tubing. Attach the leg bag to the inside of the leg using the leg straps. Remove the large bag from the catheter and place on a clean, dry surface. Remove the catheter cap and place on a clean, dry surface. Connect the leg bag to the catheter. When storing the catheter bag, you may empty and wash the catheter bag according to your doctor's instructions. At night, use the large collection bag since you won't be emptying the bag for several hours. Keep the bag below the level of the bladder. To review, follow these simple steps for keeping your catheter complication-free. Wash your hands before and after performing any type of catheter care. Wash the area around the insertion site with soap and water twice a day. Always make sure the catheter is secured using the catheter securing device. Keep the catheter and the collection tubing connected at all times. Keep the collection bag below the level of the waist. If you have signs of infection or you have any questions about your Foley catheter, please contact your healthcare provider. Thank you for choosing University Hospital, where together we improve lives.